Hey everyone, my name's Zach. You'll be hearing from me later on. I've got a keynote I'll be doing. I'm one of the founders of Hint, but I just wanted to take the opportunity to personally introduce the next speaker. The next speaker doesn't really need an intro, but I wanted to share a brief story. His writing, this is I think the 8th anniversary of his writing his first article on direct primary care. And that was actually inspiration. Some of his writing was an inspiration for me, but also others in the audience. I think actually Rob Lamberts is here, who also wrote, which was also one of the inspirations there is for us starting this company. So I want to take the opportunity to welcome to the stage Dave Chase. Thanks.
Thanks, Zach. Mic on? Well, looking for the chat. I'm going to talk about the opioid crisis. This is the next book I'm working on. Should be out on Labor Day. And I'm talking about it because it's the largest public health crisis in 100 years, bigger than polio, AIDS, motor vehicle accidents. And unlike things like Zika and Ebola and polio or flu virus, this is entirely a self-inflicted wound by our healthcare system. And it's a systemic failure. And it really represents a microcosm of the even larger dysfunction that we're all focused in on. And the book is really about creating a discontinuity in the market. There's a lot of inertia. David spoke to some of it. We're going to be hearing more of that. It's very challenging to create that point. I call it kind of the head tilt, where you're talking to some, say, employer, and they kind of like, what? Like, that's how it works, and that's how the money flows. And what you realize is there's essentially a market failure. On the supply side, which is really represented here, there's actually a lot of great solutions. Fundamental to our Health Rosetta is all the structural solutions have already been invented, proven, and modestly scaled. But those should be 100 times bigger than they are. And I think many of you experience, and David spoke to some of it, Zubin spoke to some of it. There's a lot of the people you're talking to aren't ready to make that move yet, and so it's frustrating. And then on the demand side, there are actually employers who are ready, willing, and able to move. It's still an early adopter market, and so there's this market failure that we're trying to really address, and we see the opioid issue as a real way of raising that. The old expression, a crisis is a terrible thing to waste, really applies here. And I won't go through the details on this, but this is really the essence of what the Health Rosetta is doing. It really boils down to building demand, and that's what I'm going to focus on here. You are all, in a sense, the ground troops fighting the battles day to day. We need some air cover for the ground troops. And then we're curating supply, pull out the best, and that's what basically goes into the Health Rosetta. And then simplify adoption. Today, it's really, really easy to buy really crappy benefits. We need to make it easier to buy great benefits. And folks like David Contorno and the broader Health Rosetta movement are working on that. And today, what you see here is actually before the standardized shipping container that was invented in 1956. This is what it looked like. It was just this gobbledygook of things when a ship came in, they got loaded. And really probably one of the top 10 inventions in the history of commerce was the standardized shipping container. And we use that as kind of a metaphor for what needs to be built. And probably my favorite quote, is the Buckminster Fuller quote. And I think it's the essence of a lot of what we're going to talk about today. You never change things by fighting the existing reality. To change something, build a new model that makes the existing model obsolete. If you look at the benefits plans today, and let's just speak specifically to primary care. We've done everything imaginable to undermine primary care in this country. And as a consequence, we have all these little Band-Aids. Urgent care clinics, retail clinics, telemedicine, nurse care coordinator lines. Those things should not exist, but they have to right now because of how badly we've undermined the primary care system. So this is really about building from the ground up. The bottom half are kind of some of the underpinnings, the process. And then as you see, what we call value-based primary care, this sort of overarching term for things like direct primary care and the quality near-site, on-site clinics. That's really the foundation, not an afterthought, a bolt-on. Like, there's no well-functioning healthcare system in the world that doesn't have a well-functioning primary care. So we just got to man and woman up and build it. Doesn't happen overnight, but that's what we're focused in on in kind of these standardized shipping containers with some technology and process to basically stitch it together. One thing I should say, since Zubin was talking earlier, we look at, Health 3.0 is really the vision and the North Star of where we're driving towards. The Health Rosetta is kind of the travel tips or roadmap on how to get there. And that's how as Zubin and I talk about, that's sort of how we look at it. There's a journey to get there. And what we see is nothing changes in healthcare with the purchasers until there's the mindset shift. And we find there's three things that drive it. It's fear, greed, and love. And I'll just speak to the love piece because it really relates to the opioid issue. Without exception, every person I've spoken to, and including some of the largest employers or business owners, when you talk about the opioid crisis, everybody has been personally touched by that. And when I tell them that they as the employer are the key enabler of the opioid crisis, that's kind of jarring to them. And they're like, what do you mean by that? Of course, unwitting enabler. But if you think about the opioid crisis, who's impacted? It's working age people and their dependents. Who pays for that? Largely it's employers in this country. If you're not low income or elderly, generally you're getting your benefits through your job. So our benefits have fueled this crisis. And nobody wants to be in that position. That's when you see people going, okay, I got to do something. I think Alex Lickerman talks later. Cousin of his, Todd Lickerman, he was the CEO of one of the largest real estate companies in the country. And he read my book, and he's really been now getting very committed to this movement. This kind of has that point of righteous indignation. He's like, I realize the benefits I was providing, and they were pretty good benefits, were cruel and unusual. That's what we're actually providing to the workforce in this country. And if you're a fan of the opioid crisis, you should be a fan of the status quo benefits. Even today, with all the awareness around the opioid issue, with large employers, 30% of all the members of an employer-based plan every year will get at least one opioid prescription, even today. There's not evidence behind a lot of that. And it basically, if you're on an opioid for 7 days, it's basically Russian roulette at that point. 1 out of 6 are going to become addicted. So we're continuing to fuel this crisis with the status quo. I use this illustration a lot, which is, you see these two clinicians mopping up this wet floor. The floor represents those enslaved by opioid overuse disorders. And absolutely, we need more mops, better mops, more moppers. But if you look at our response to the opioid crisis, it's 98% focused in on the mopping, which we need to do, of course. That's a big issue. But we need a balanced approach. We will never clean up the mess if we don't go upstream. And you see in the background there, the sink's running over, the faucet's still going, as I mentioned. We continue to have extraordinary rates of opioid prescriptions. And so we're saying we have to have a balanced approach. And if you look in my current book, chapter 20, I added around the opioid crisis, and really my next book picks up and where that left off. At the root of, it's a multifactorial problem, and it's a multifaceted solution, but the biggest common thread is you have to have proper primary care in place. If you look at what fueled the current, in this horrible opioid crisis, a big part of it is our undermined primary care systems. What can you do in 7 minutes but, refer, prescribe, and unfortunately, a lot of primary care docs were told that it wasn't addictive, but a lot of it is this machine that wants to overtreat you and provide non-evidence-based, spinal procedures or non-evidence-based prescriptions for lower back pain. That's what's in place today. and we have to address that. And so really this next book, in some sense, is just the next edition of the current book. If you read that, it has a different target audience and different framing. Of course, the framings around the opioid crisis represented a microcosm of the larger dysfunction. But then there is what we're really trying to do with this next book, whereas the last book was targeted at business decision makers, the next book is targeted at changing the zeitgeist in our communities. So trying to reach mayors, school board members, faith and social service leaders, police chiefs, fire chiefs, to get them to be aware that the status quo is fueling this crisis and we will never get out of it if we don't actually look at the systemic fix. And so you see some of the new chapters in there. I'm going to have a link later. If you want to get a preview of the book, you can look at it. But I'll just give you one little example of some of the content on how to change the book. I have a chapter around economic development 3.0. I share things like this where, you're all probably familiar with this notion of shop local, in retail and food and whatnot. But if you actually look at what's going on today, the value creators in the system, the nurses, the doctors, and so on, are getting less than 25 cents of every dollar. And then you see where the rest of the money is going. Much of that is leaving communities, out-of-town owned hospitals, out-of-town owned health plans, and a lot of non-value add stuff. This is massive dollars leaving the community. And so this is part of reframing, okay, this is about really thinking about the health of the community, not just the sick care part. And, it's like the analogy I use with some people and like with mayors is a lot of them are thinking, health, that's kind of the healthcare system. People deal with that. And of course, they're a big part of it, although clinical care only drives 10 to 20% of outcomes. But to think the hospital is going to be the right one to sort of architect the healthcare system in a community is to think that you should have your fire chief be in charge of urban design. Now, they need to have a seat at the table, but we'd have very different cities if fire chiefs were the head of urban design. So you need to be thinking about it differently. So there's a lot of looking at this thing differently. And we're going to have a roadshow that will basically go out and see which communities are ready to step up. Another example I give of how these things shift, and you can use analogies like LEED for a green building and how there were certain communities that were early adopters of that. Places like Portland, Oregon kind of proved it out. But it was a 10 to 20 year process for that to get mainstreamed. And so, or you look at the electrification of America. It wasn't like there was this magic day where the president had this circuit breaker on, whoop, like the whole country lit up. There were certain communities who stepped up, and in this case, the enlightened communities will be the ones who step up early. And so it's very clear that pick your community. I see Rob over here. Dave Chase is not going to fix healthcare in Augusta. It's Augusta people who will fix healthcare. And so we're going to see which communities will step up and are ready for this mindset shift. So it's going to be this very bottom-up discussion and movement. And so we're going to have some more discussion tomorrow. If you want to be very engaged and active in this movement, we would love to have your support. That's, as Zubin was talking about earlier, it's on us. The cavalry's not coming from DC to fix healthcare, if you haven't noticed. And so it is on us to fix it. And so it is this bottom-up movement. We have this philosophy we call get on the bus. We know where we're headed. We're going to have a great ride getting to that destination. Sure, there's probably going to be some flats and some potholes and whatnot, but it's going to be a great ride. We got a great set of people on board. And if you want to get on the bus, we're happy to have you on the bus. There may be another bus in the future. But that's really our message out to the community. We're not in sales mode. There's people that what we are all doing in this room, it's magnetic. They will come on and join us in that journey. And so certainly invite you to do that. And just to wrap up, I've got some resources here. You can go to the website. You can download the current book at the healthrosetta.org/friends. Feel free to share that promiscuously. And then if you want to get a preview of this next book, and I think the slides are available, so I'm happy to have that. You can go to this URL and you can download the new book and get more, some of those chapters I laid out. Because as we do, one of the things I should have said on the roadshow, we're going to be really focused in on how you can't fix the opioid crisis, you can't fix the larger problem without primary care, and we're going to really be shining a light on that. And so we need, and frankly, the primary care docs are some of the most trusted people in communities. So invite you to join that. And if you want more of how the Health Rosetta and Health 3.0 connect, we've also got a link there. So I just hit 0, so I think we're on track. And look forward to talking with you all during the rest of today and tomorrow. So with that, I'm done.